Okay.
Okay, welcome everyone to the latest edition of CB8 Zooms. I'm Lori Boris. I'm trying to fix my computer here to tell me that, sorry, that we're being recorded, and I just want to get rid of this. I have a new Mac computer, which I'm very happy about, but it takes a little getting used to. And
It does.
there we go. Okay, great. Hi. So hello, everyone. Thank you for joining us for CB8 Zooms. It's a webinar about public affairs in Community Board 8, which is located in Manhattan from 59th Street to 96th Street, from the East River to Central Park, and also includes the lovely Roosevelt Island. I'm Lori Boris, and today I'm a member of CB8. And today we are joined by two fascinating guests, Marlene Schneider, who is a former vice president, excuse me, for the National Council on Aging for more than 20 years. And also by Ilana Kiefer, who's director of the New York Academy of Medicine's Center for Healthy Aging. And we're going to talk today about a very exciting development in the world of older Americans. And if you have any questions, you will ask them in the Q&A at the bottom of your screen, and we will get to as many of them as possible. So please, as our guests are speaking, if you come up with a question that you would like to be answered, you put it in the Q&A at the bottom of your screen, and we'll try to get to as many of those questions as possible. Okay, so welcome to both of you.
Thank you. Thank you.
Hi. So Marlene, let's start with you. At the end of, I'll give my introduction first. The senior population, as we all know, is rapidly expanding. It is much more common in 2023 for people to live into their 80s and even their 90s. And we heard today that Dianne Feinstein, the senator, was 90 years old and she passed away. But she was working up until the very last minute, and we want to pay our respects to Dianne Feinstein. So the fact that people are living so much longer is obviously good news. But the needs of the elderly population are different. In housing, in transportation, in communications, and obviously in health, which I think everybody recognizes, but not necessarily the other items that were mentioned. So at the end of 2022, Governor Kathy Hochul issued an executive order to establish New York's first master plan for aging. Now, Marlene, let's start with you. So why do we need a master plan on aging?
Well, I'm so glad you asked. And we have slides to help explain it all. So Ilana, do you want to bring up those slides? Okay, so Ilana and I worked on a quick PowerPoint for you that will address many of these questions. We will cover why a master plan for aging, why do we need one, the timeline, status, and structure of the rollout of the research and the rollout, topics covered in the master plan for aging, the structure of planning for it, what's contributing to it, and additional resources. So the master plan is designed to ensure that older adults and individuals of all ages can live healthy, fulfilling lives while aging with dignity and independence. It will build on decades of work and partnerships with state agencies, local governments, and stakeholders. This plan was first announced by Governor Hochul in her state address and in the fiscal year 2023 state budget, with an executive order number 23, which you'll see a lot if you do any research on it, which was signed on November 4th, 2022. So population growth, as you were just addressing, Lori. New York ranks 4th in the nation in the number of individuals age 60 and over. By 2030, this population is expected to reach 5.3 million. Currently, it's at 4.6 million. Also, by 2030, 51 counties in the state will have a population with 25% of individuals being age 60 and older. This highly valued population contributes substantially to the economic, social, and cultural vibrancy of our state. Such contributions are a source of strength that New York proactively embraces through supportive policies in the Master Plan on Aging. So key contributions. Approximately 935,000 individuals age 60 and over contribute 495 million hours of service at an economic value of 13.8 billion. 64% of older adults 60 plus own their own homes and have no mortgage, contributing to the state and local tax base. Older adults also contribute directly to New York's long-term care system. And there are 4.1 million caregivers in New York State, and their average age is 64. So the caregiving for people of all ages is valued at 32 billion if it was paid at the market rate. So there is a real need for a plan for aging in the state. We'll move on to the structure, and Alana, if you want to.
Sure. So the Master Plan for Aging is a very long and careful strategic planning process. So as Marlene had said, the executive order was issued in November of 2022, and the Master Plan for Aging process is being run on a state level by two state agencies, the Department of Health and the New York State Office for the Aging. So they're working together to kind of oversee the whole planning process. But as you'll see later, there are like 350 people involved in this plan. So it is not an easy feat. Also within this plan, so you have the two state agencies, and then there are two governing bodies made up of various stakeholders. There's the Master Plan for Aging Council, which is made up of state agencies, and that includes, of course, Department of Health and Office for the Aging, but also Department of Education and Energy and many other important stakeholders. Even if you don't necessarily think that they need to be at the table, they do, because of course, aging affects really every sector of the state. And you'll see that has 21 different agencies there. And then there's the Stakeholder Advisory Committee. So that's made up of individuals that are experts in topics related to older adults, aging, and long-term care. And that has 29 members of it. And you can see on the bottom of the screen, it's from the corporate sector, the nonprofit sector, as well as research and advocacy. So this is just kind of like explaining in a graphic form the structure of how this is planned. So we talked about kind of like the first two levels, so the governor and then the Department of Health and Office for the Aging, and those two governing bodies. And then below that are, it looks like 8 different subcommittees. And this is where I hope you guys are thinking, like, this gets you thinking about what topics are going to be included in this Master Plan for Aging. And just as a reminder, we are developing the plan now. The plan has not yet been written. It's typically a 2-year planning process to develop a 10-year plan. And there are other states that have already, there are a few other states like California that have already developed a plan like this, and many more states are starting to now. So you can see the different kind of, and we'll show you in a second, more specifically, the different topic areas within these categories of these subcommittees. And then I sit on 2 of the work groups in informal caregivers and in housing, community development, and transportation. And we meet on a weekly basis to inform those sections of the Master Plan for Aging. I just want to stop and Lori, see if you have any questions or comments so far.
Yeah, no, thank you. Thank you for doing that. Yeah, so I was gathering from both and this is an excellent graphic. So this is not something that is implemented at all yet, correct?
Yes.
We're in the planning
Correct.
stages. We're in the planning stages and the gathering of data, right? So, and we're going to tell you away at the end of this, how if you have concerns about or issues about aging, that you can contribute your thoughts and your things about it. Okay, so I'm sorry, go
Thanks,
ahead.
Lori, because we really did want to make that clear. That this
Yeah.
is a process that we'll be stepping through on this PowerPoint.
Correct. And also just to note that we'll say it in a later slide, but New York State was actually designated as the first age-friendly state a number of years ago. So it's not like the state has not been planning for older adults and aging. We certainly have in many different ways for a long time. But this is kind of like a national process that's happening state by state in a kind of very specific way of planning. And that's what this is really about.
Okay, great. So they're gathering data, right? They're
Well,
gathering.
it's definitely gathering data, but it's also trying to define what the problems and the challenges actually are, and then also coming up with recommendations. So that all of that will kind of informs the plan.
Excellent.
So speaking of the timeline, here's the timeline. So we already said the executive order was signed in November. Meetings have been happening throughout 2022 and 2023. We're at the point now, you can see by the check marks that well, actually, if you'll see up the top, July 2023, the preliminary report was due, and the preliminary report was actually published. We have a link to it, but you can also just look online to see kind of what work has already been done, and you can read more specifically about the different subcommittees and working groups in that preliminary report, and that was sent to the governor's office. And that's kind of more talking about the challenges within each of those topic areas and what the plan needs to address, and some of the data, to Lori's point. And then over the next year and a half or so, that's when we'll be working on the recommendations for those different areas. And just to note down in the note below, that once the plan is actually delivered in January of 2025, the work does not stop there. So there will be different benchmarks to track how the plan is being implemented, and we will be using data. The whole state really will be using data to really kind of use the data as ways to track different metrics of the variety of recommendations that will be found in the plan. So as we said, here are the different topic areas. So long-term services and supports, home and community-based services, because a lot of care when older adults need it is provided in the home. Areas around for formal caregivers, so that could mean certified nursing assistants in the nursing home setting, or home health aides in the home setting. Anyone that's paid in some way to provide caregiving. And then informal caregivers are family or friends that are caring for older adults for a variety of reasons and or needs. Safety, security, and technology is kind of a all-encompassing term, but one big thing I'll just note in technology is making sure that older adults have digital access, and that can be both in terms of actual physical, having a tablet, let's say, if they don't have one, or knowing how to use it, or making sure that people have Wi-Fi as well. Health and wellness around kind of, physical health, emotional health, and the like, economic security, and then housing, community development, and transportation. So that's around making sure that there is enough housing that's affordable and safe, making sure that there are curb cuts and making sure that buses are knowing to pull up to the curb, things like that. All those kinds of things are obviously very important for all of us, and especially for older adults. And those are the different topics. And then within that, I'm just going to go through these slides very quickly. These are the different kind of like working groups underneath those different categories, just so you can kind of get a sense for the different topics that are going to be covered in the master plan for aging. And these are them for economic security and long-term services and supports. And then down here, home and community-based services. We were talking about both in-home and in-community, aging in place, safety and security, are a lot around scams. That's a really important one to think about. Elder abuse, guardianship issues, as I said, technology. And then health and wellness, again, is around physical health, emotional health, and then also access to Medicare and Medicaid. That's huge, huge. So really ensuring that people are going to their annual wellness visits and utilizing the benefits that do exist across the state. And then really looking at things around Alzheimer's and dementia, and then also nutrition. And then this is, again, just kind of like more nitty gritty around how the kind of large planning committee is made up. There's, as you say, 351 total members. And you can see what's great about this is it's a very multi-sectoral endeavor. So there are people from, of course, that work specifically in aging, but also in the fields of medicine, transportation, technology, labor, government, et cetera. And the state is really pushing hard to ensure that many different voices are heard on these different planning and on this committee as a whole. So ensuring that historically disadvantaged groups are really represented, and that we're talking about topics that specifically impact these communities as well. And you can see here, certainly BIPOC, Black, Indigenous, and people of color, but also New York State, as you know, we don't think about it as much in Manhattan, but it's actually a fairly rural state. And so we want to make sure that we're addressing the needs of rural aging, and rural aging can look very different than urban aging. So we really do try to talk about that as well. And of course, the disability community, there's sometimes overlap between aging and disability needs, although not always. There have been a lot of meetings, as you can see here, and there will continue to be more meetings to plan this. Then we already talked about the agency council and the advisory committee. So it's really just to kind of give you a general sense of how busy we have been with this.
So it seems that there's a real effort for equity. They want to hear
Yes.
from all of the communities who get older.
I mean, right, like New York City is so diverse in so many ways, and New York State is also really diverse in so many ways. And just a big state. And so we really just, that's why it is such a quite an endeavor to work on this, but obviously a very worthwhile one.
Right.
So as the slide says, New York State wants everyone's input. So anyone who wants to provide input, there are 3 links here to do it. And we can make all of the links. We have further links, links further on in the presentation. We can make them all available after.
Okay, yeah, we can put them in the chat, or we can, we'll make them available later. That's excellent. So as I said, if you have a question, we can try to address it. Oh, actually, we have one question. Do you want to go to questions yet, or do you
We
have
have a few more slides. Should we?
Okay, go ahead.
Additional resources.
So I'll just make one note about this slide. So if you have general questions about the master plan for aging, or want to like make sure that a particular issue is submitted, you can email at that email address. They're also doing town halls all around the state. So if you go to the website, you can see when there's some upcoming. I encourage you to go to them when it comes to your neighborhood. And they're also doing a statewide survey to really better understand what's going well in New York State and what is not going well in terms of growing older. So you can go to that link to complete the survey. And then these are just some other additional resources. So you can read the preliminary report, as I mentioned, that's available online. This is also a report about kind of age-friendly New York in general. And you can so that's a lot of the work that has been done prior to the master plan for aging process. You can also go to my website. My organization is the New York Academy of Medicine. And we have a lot of information about age-friendly work, both in New York City and New York State, and then in other areas as well. And then, of course, you all are living in Manhattan. So the New York City Department for the Aging has quite a wealth of services and resources for the 60+ population. Of course, there's like older adult centers and naturally occurring retirement communities, food delivery, and many other services. So I encourage you to check out their website as well. And now I'll turn it back to Marlene.
Hi. So New York State also has a website where you can get assistance and find out about benefits and get help. And we'll distribute this website as well, but New York State has a very thorough website to help people find out about benefits. Another New York City website is Access NYC, where you can find out if what programs you're eligible for food, money, housing, and work. And you can actually apply for some of the benefits on their website. So it's another website that should be checked. And the last website we have here is Benefits Checkup, which is where I used to work. It's a service of the National Council on Aging, and it's a national screening tool for low-income older adults and people with disabilities. And it's very extensive in New York, but if you have family members or friends that live in another state, you can also use Benefits Checkup to find out about that. And we wanted to make these resources available now because, as Alana mentioned earlier, it's a process for the plan to come out It will take several years. So there are benefits and opportunities available now.
Right. So people can get, thank you for making that point. People can get help right now in certain areas, and you have provided really wonderful agencies to check with. I find, first of all, let me say that I'm really proud to live in New York State right now. I mean, in general, I'm proud, but when I hear these specifics about all the services that are available, it just makes me feel really good about living here in New York. But I find that that a lot of times older people don't want to ask for help. And I'm not sure why. I'm not sure if it's like a pride thing where you don't want to admit that you're older and that you need help, which, I mean, everybody feels that way, you know, but how do you encourage people to get over that and to just ask for the help that they need?
Well, we learned at the National Council on Aging that even though you're right, people do not want to ask for help, they don't want to contact government agencies, they will talk to their friends about what they're doing. They will get together at a senior center. They will get together and say, you know, what health insurance do you have? Or which Medicare plan do you have? How are you getting help paying for your food? And there's a great network of seniors who do this. So that's one way. But this, other than encouraging your family, you know, having these tough conversations with your family and encouraging them to check out these websites or do it for them, since they're all so easy to use. You can do it anonymously at first, just to see if there's anything there that's of interest to you. And then you could sit down with your family and friends and help them through it.
Yeah. Oh, that's great. I mean, and that's why the socialization part of this, you know, picture is so important, you know, because sometimes elderly people become isolated and they don't socialize and they don't, you know, get together. And that is so important, just both for your mental health and just for you know, for socialization. We're a group people, you know, we're meant to be with people. We're not meant to be to do it all alone. So I encourage people who need help to ask for it. There's no shame. There's no shame in asking for help. You know,
And
it's
also there's really no shame in getting older. And unfortunately,
Right.
we live in a society that really just does not value getting older. There's you know, they say ageism is the last acceptable form of ism in this country.
Yeah.
And there's a lot of kind of, I think, self-reflection we all have to do around that. And also that older people are people, they're people we're all people, you know, everyone's getting older every day. So to think about it, I think a lot of people do have a hard time identifying as an older person. There's a joke that old age is always 10 years older than whenever I am.
Right.
And so I think
Yeah.
to kind of even just think about, oh, I need specific help with this particular need because I'm not able to, you know, take the bus in the same way anymore, whatever that is, rather than being oh my gosh, that means I'm an older person and I'm decrepit and I'm going to die soon and this is terrible and I don't want to think about it. To the kind of, again, take it more specific. And I think as a society, we have a long way to go in terms of honoring the aging process, recognizing the limits of getting older, and also just, you know, saying it's all still just people.
Right. It's we're all just, you know, human beings. I say one thing. I know that if you've watched this webinar more than once, it's you're probably really sick of hearing about this from me, but I have multiple sclerosis, you know, and I've had it since, you know, for more than 20 years. So I learned a really long time ago how to ask for help. And it was such a valuable lesson, you know, because now to this day, I'm not afraid to ask for help. I mean, I state my needs and you can usually have them met, you know, but if you don't ask, then people don't know, you know, because people, I find, want to help. In general, people want to help, but many times they don't know what to do. So if you're giving them a gift, if you tell them what would be very helpful to you, they'll be thrilled to know what to do that helps, you know. So anyway, all right, let's go to our questions. Judy Schneider, who's a member of Community Board 8, asks, does insurance such as Medicare cover formal or informal caregivers? And if not, will this plan help in this manner? Who wants to take that?
I could tell you what it does now. So Medicare has very limited coverage for caregivers, for caregiving. If someone comes out of the hospital after a surgery, they'll do it for maybe 5 hours a day for a certain amount of time. Medicaid does give formal coverage for caregiving, but Medicare does not at this time. I don't know if, Alana, I don't know if you know anything about their plan is investigating on that topic.
They're definitely looking at it, and I'm just gonna add, I think I can do hosts and panelists. Oh, no, I can't put that, but there, if you look up, there's a Medicaid program called CDPAP, Consumer Directed Personal Assistance Program, that actually pays for like relatives or friends to provide kind of informal caregiving. A lot of people just don't even know that it exists.
Yeah, it's a really
So I'm
good
just kind of bringing it up. And there are certain, qualifications, and I don't know exactly how that works, but I would encourage you to look up CDPAP, and that program is run through often different home health agencies. So it's not kind of one place you go to. You can, go to Blue Sky Home Health Agency, and they might have a CDPAP program, and then you'll basically, I think a spouse cannot be paid, but like an adult child or a friend or a neighbor can be, and really get paid on an hourly basis to provide support.
Yeah, that's a wonderful Medicaid program, I have to say. I have been looking into, the possibility of having myself qualified for Medicaid for that reason,
Yep.
just for that reason, because and you need to hire a lawyer, and a lawyer has to do it. But I'm sure that there are lawyers that you can hire from the various agencies who will, who know about this. It's like an elder care issue, and it's a really big issue. And, just because, like we're all going to get older, so it's worth looking into what the future may or may not hold. It's like, and I just, because I have this disease, it's kind of like a stab in this to like, you better do something about this. Because so when I moved to a new apartment, I thought to myself, okay, I'm going to make this place as accessible and move aroundable as possible. And it's the thing about doing it is that it allows you to relax. It allows you to say, okay, like I've done everything I can possibly do so that I can age in place, and that's just a very reassuring thing to do. I mean, when my father, was ill, he was just fighting so much, anything to do with, making his home accessible. And, his home was like not accessible at all. So I think it's important for people to just take a look around, and look at your surroundings and just think, because sometimes and I wanted to ask you this, Marlene, I think you know this. What is, there are, or are there, the question is, are there low cost ways that you can make your home more accessible, or get around more easily, or or what are the ways that people can try to do that?
Right. So if you're on Medicaid, they offer a wide array of services. If you're not on Medicaid yet, there are programs, and if you go through Benefits Checkup or any of the other screening tools we mentioned, they'll even come in and do home repairs for you if you qualify for it. So there are some home assistance programs available. It varies by county and city. So it definitely have to go through one of the screening tools and go to those websites, but yes.
Okay, great. Okay, let's go back to another question. And wait a minute, let's see. Here, this is from someone named Peg Graham. She says, hope this includes coming up with ways to help our specialty physicians to work more closely with their primary care colleagues and hospitals, to work more closely with community organizations, to embrace preventive care and supports for aging at home. receiving care at home. This means that the usual suspects need to think differently about what health means. It does not mean medical care, so much broader than that. Some of the money now housed in hospitals and MD offices could be redirected if people were willing to reset, right? That's a complicated question, but I think, yeah.
I mean, the one comment I'll just make is to really think about, I mean, I completely agree. And I do think the field of geriatrics, which is specifically the medical field of working with older adults, is probably better than other fields at being interdisciplinary, both within and outside of the medical field, because you almost have to. And there are often might be, comorbidities and different issues going on in the patient. And so you might have to talk to a cardiologist and an endocrinologist. And the geriatrician is really meant to kind of, like in primary care, oversee the whole person's health. But the other nice thing about geriatrics is that it really is kind of more attuned to more nuanced issues around aging. And so there might be kind of like a different conversation around what does success look like? And just like as an example, I used to work in hospice. And so when you work with physicians that focus on end of life care, that's a very different conversation than you would even with a PCP or someone else, because you're really trying to think about what is kind of, what is comfort care, what is going to make the patient feel the best, and maybe surgery is not the right thing at this stage. It may or may not be, but I just think kind of in the geriatrics field, they're more attuned to those kinds of questions, as well as perhaps issues around cognitive impairment. But I completely agree that there needs to be a lot more kind of integration and really thinking about kind of where we're putting our money.
Yeah. It's speaking of gerontologists, has there been, and I don't know the answer to this question, but, and perhaps you do, but has there been growth in the number of gerontologists? I mean, certainly it can't be that it has grown as much
We don't have enough. Yeah, there are not a lot of medical students that are going into geriatrics. There are not a lot of there are geriatric fellowships are often looking for people to become fellows. It's a problem.
And is that one of the things that the master plan on aging is looking at?
I don't maybe in the workforce. I don't actually know. It's certainly we in the field are very aware of the issue, and there are certainly kind of some initiatives aimed at addressing that. But I don't think it's a major focus. It's not a major focus of the MPA. And of course, you don't have to be a geriatrician to see an older patient. Many primary care physicians, a lot of their patient load is older,
Right.
but it certainly can help. But again, it's not always as kind of, compelling of a field. I think it is, but we need to kind of figure out how to kind of sell it better.
Yeah, I certainly think it is. I mean, just because it's like you have more and more patients, there are
Totally.
more patients out there.
Totally. Yep.
And the issues are very different. There are things that happen as we age that don't necessarily happen when you're younger. I mean, like you have to talk about the importance of hydration. I mean, even like simple things, like hydration, exposure to the heat, like all the things that we deal with,
absolutely.
right?
And also sometimes in geriatrics, there might be other people more involved. So maybe like an 85-year-old woman is going to bring her 60-year-old son to the doctor's visit. So there's sometimes kind of nuances in that case that you might not see in other fields, but a geriatrician is probably more used to that.
Right. Okay, let's go back to, there's another question here. It says some hospitals in other cities have adopted the Capable program, an innovation that comes out of Johns Hopkins. We need more of that in New York City. I'm not familiar with that. What is the Capable program?
I've heard of it. I'm just looking online. It stands for Community Aging in Place, Advancing Better Living for Elders. And I think it's around kind of, let's see, the 4 to 5 month program integrates services from an occupational therapist, an RN, and a handy worker who work together, I think, to make sure that the home is safe. And there's a lot of, I think, opportunity in ensuring that that you can make some minor modifications to a home to make it safer for an older person, to prevent falls, to be able to reach things more easily. And so and the Johns Hopkins program is a pretty well-known one that I think been proven to be effective. There are other programs that are being tested as well. I know Washington, DC has like a program where there's a pretty kind of low eligibility bar, and you can have an occupational therapist come in to make recommendations as well, and then make changes to one's home.
Yeah, there was an article in the New York Times, I want to say last year, maybe. And it was about just that subject that you just discussed, about how the simplest adaptions, make a big difference.
Totally.
Putting a grab bar in an appropriate place, makes a very big difference between being able to stay and not being comfortable and being susceptible to falls in your home. So yeah, so some of it doesn't break the
Doesn't
bank.
require, capital construction.
Right,
Yeah, there's
exactly.
one really good one I know of. Is for people that are hard of hearing. They might not be able to hear a smoke alarm. So there are smoke alarms that flash.
Flash, right,
Yeah.
right. That's great. That's great. Okay,
We
well,
also have programs in New York City, weatherization and LIHEAP to help with heating and cooling and preparing the homes for the cold. So people are not living with drafts, and that's all paid for if you apply for the program.
so let me ask you this. How much overlap is there with the ADA? I'm very supportive of the ADA, and I'm always sort of a loud person at the community board about, like, hello, it was passed in 1990, like what what have you guys been doing? So how much of like care for the elderly overlaps with ADA or with the master plan, I guess?
I mean, I'm not an expert on the ADA, so I can't really speak to it, but I will say that there, of course, there is overlap, but not always overlap with disabilities. And of course, disabilities is a very broad field. But I think in terms of physical disabilities, there's definitely, I would say, especially in the work group I'm in for housing, community design, and transportation, that's really thinking about kind of those different areas and how we can make sure that for people that use walkers or wheelchairs or just kind of slower than a 30-year-old pedestrian, how we
Yeah.
can make, and also having traffic calming measures and like different things that really kind of just like just are supportive of people are there. So I definitely know that is being addressed. And then the whole housing issue, definitely, of course, if you're going to be building or renovating housing that's geared towards older adults, it needs to be kind of with those built-in modifications already.
Right. Yeah, housing and transportation, I think, are the two really big,
They're huge.
the big
they're
things.
huge.
Okay, let's see. What else was I going to ask you? We don't have any more questions coming from us. Let's see. Yeah, because it's 2023, and many seniors are living in housing and getting around in facilities that were built way before the ADA, and not that the ADA has actually, made as many improvements as I personally believe it should have. But how can we give a push, for the ADA in terms of, I'm not being very articulate about this question.
There's been a big push recently on all the subways that don't have elevators. And they are rolling them out month by month with a goal. I don't know the exact deadline of when they expect to have it in every subway station, but there's been a very big focus on that.
Yeah, no, that's good. I appreciate that. But the fact is that only 25% of the subways are accessible, and that means 25% when all of the single elevators are working, and that's a problem. I was at the 57th Street station for the Q train, I believe, and I went to go use the elevator, and there was a man from out of state, in a wheelchair, a tourist. He was a tourist in a wheelchair, and the elevator was out.
Hmm.
And I just, I apologize. I said, I apologize for being a New Yorker because I was like, this should not happen. It's like we need to, and again, as the population is aging, more of this is going to become necessary. So we need to really get it together. Because and now he was with his family, so it was good that he was with people who could help him, and they were going to map out a route where he'd have to go back from where he came and then look for another or take an Uber from somewhere. I don't remember how they figured it out, but it was just, I felt so bad for this man. He was just like sitting outside the elevator and it wasn't working, and I just, that to me is unacceptable. It's,
Was there a sign?
huh?
Was there
There-
any information about it? Was there a sign on it?
There was a sign on the elevator, and I'm sure that the MTA has made some improvements so
Yep.
that you can call a number. There's a number you can call or look up something on a website where it'll tell you where the elevator. But these were tourists, so they were just how do they know? Anyway, so and the irony of this was that they were from Portland, Oregon. I don't know if you've ever been to Portland, Oregon, but they have a magnificent mass transit system where people in wheelchairs get on and off on a daily
Wow.
basis. Like it's no problem,
Yeah.
it's no problem. So I think that, we'll talk to Mr. Arroyo about that. So yeah. All right. Is there anything else that you want to add? Do we have any more questions? I don't think we have any more questions, but is there anything else that you would like to talk
I just
about?
want to offer that if anyone would like us to walk through those websites and how you can screen for benefits, how you can easily enroll in them, we would be happy, or I'd be happy to do that, to do another session on that and really delve into it in New York City, where you get benefits, how you get them, what it means to enroll.
Oh, that would be great. That would be great. Can you put up the slide? I don't know if you can do this, Marlene. Can you put up the slide again that has your contact information and Ilana's contact information?
I just closed it. Hold it. Give me a minute.
Yeah, thanks.
Put it back up.
I'm sorry. In the meanwhile, I will say that, hold on. Okay, again, the email for, wait a minute, I have another question. Maybe there's a question. Let's see.
We will send you all of those links that you can distribute, Lori.
Excellent.
Yeah.
That's excellent.
It's a lot of links for people to have to write down right now.
Right. Okay. Yeah. Well, it'll all be on our website. If you were not to see this live, we can you can see it again. It'll be on YouTube and it'll be on our website at www.cb8m.com. And I want to thank Will, the wizard behind the technology that gets CB8 Zooms on YouTube and Facebook and our website. What are you saying? Oh, and the governor, I want everyone to remember that the governor and the state are listening. They are listening. And so, so if you want to contact them, I hope you will contact them because they are listening and they want to include you in the master plan for aging. So I want to thank our guests, Elena Kiefer and Marlene Schneider. Thank you so much. This has been incredible. And my name is Lori Boris, and I'll see you next time.
Thank you.
Bye.
Bye-bye.
Bye.